My name is Amy Dobberfuhl. I am a urologist from the United States and practice at Stanford University. Our presentation is titled Sex Differences in Radiation-Induced Bladder Dysfunction are More Accurately Captured Using the ICIQ FLUTS and MLUTS Questionnaires in an Observational Radiotherapy Cohort. Here are our affiliations. Our background and aims were to examine sex differences in radiation-induced bladder dysfunction following radiotherapy. Men and women with storage and voiding dysfunction were prospectively enrolled in an observational cohort, enriched with women undergoing radiotherapy for cervical and endometrial cancer. Our methods. There were 205 men and women consented for enrollment over the 6-month study period. A total of 176 questionnaires, including the AUA symptom score, ICIQ FLUTS and MLUTS, and 12-item short-form health survey were collected. Participants with complete data were included for analysis. Our primary outcome was gender differences in the storage, voiding, and incontinence domains of the ICIQ questionnaires. Data were analyzed in SAS using ANOVA with 2-key correction for multiple comparisons. 136 participants completed questionnaires, which included 52 non-radiated women, 18 radiated women, 55 non-radiated men, and 11 radiated men, and they had a mean time since radiation of 3,530 days in men and 2,615 days in women. Our results. There was no significant difference in post-void residual or AUA symptom overall score between any groups. All domains of the AUA symptom score failed to capture between group differences in storage and voiding dysfunction in radiated individuals, with the exception of difficulty postponing urination. Non-radiated women reported significantly higher AUA symptom quality of life score, and this did not differ significantly compared to radiated women. In the storage domain of the ICIQ, there was an increase in urinary urgency after radiotherapy, with male gender protective and no difference in nocturnal and daytime urinary frequency. In the voiding phase domain of the ICIQ, radiated men had the greatest intermittency. Radiated women tended to have the lowest hesitancy, and there was no difference in straining. Across the incontinence domains of the ICIQ, radiotherapy uniformly increased urgency incontinence and nocturnal enuresis in all radiotherapy groups, with more men reporting stress and unawareness incontinence after radiotherapy. In conclusion, the ICIQ FLUTS and MLUTS are more sensitive than the AUA symptom score at classifying the burden of storage and voiding dysfunction in men and women following radiotherapy. Further research is needed to better classify gender-specific changes in lower urinary tract function following pelvic radiotherapy.